Hello friends, and welcome back to the next video. So in this video we are going to talk about some hallmark finding related to some difficult topics which are hard to cover, and we will see some question definition portion over it. So we are going to talk about the obliterating endarteritis, Takayasu disease, the sarcoidosis, Furuncle and Carbuncle, Alzheimer's disease, Hidradenitis, Coarctation of aorta, and Brucellosis. So let's start. First is obliterating endarteritis, which is also known as Burgers disease. So what is this? So this is chronic inflammatory condition which affects the inner lining of the arteries. And or another definition below, inflammatory thrombolytic disease of small and medium arteries, mostly cause problem with the lower limbs. So what we are going to see in the patient is claudication, sir, short distance walk. So the patient will not be able to walk more than some meters. So the question says, the patient says 32-year-old pain in the left leg for a year with intermittent limping after walking 50 to 100 meters. Sir, these are not the cases of angina pectoris that you want to classify them in some stage. This pain is not in the retrosternal part. This pain is in the leg portion. So a periodical nocturnal pain, the left leg is pale and cold, arterial pulsation is not there, not detected there in the left lower leg. So sir, this is also the hallmark findings here. In this question, the intermittent claudication 50 to 100 meter, this is a hallmark finding for Burgers disease or obliterating endarteritis, and the pulse was not there in the lower leg. So this is something hallmark finding for the obliterating endarteritis. And sir, why the leg is pale and cold? So arterial pulse is not there, it means there is no supply over there. So when some part is ischemic in our body, it will look pale or bluish, or it will be cold in nature. Let's go next is, sir, Takayasu arteries. So sir, Takayasu arteries is the large vessel disease, or let's say we also call it pulseless disease, because like obliterating disease, this will also we will also see no pulse in such patients. Since this is the problem with the large vessel disease, let's hear from patient itself that which are the large vessels in our body. So 23-year-old woman saying headache, dizziness, chills, numbness, sharp weakness in the left arm, inability to hold objects increasing over the last year. So sir, the arm, she is complaining about the case is related to Takayasu arteries, and she is complaining about the sharp weakness in the left arm. So left arm, now you know that left arm is the large vessel. So next, recently 2 episodes of loss of consciousness, examination detect no pulse is there. So sir, this is something hallmark for Takayasu, and no pulse there in the legs, it will be hallmark for Burgers or obliterating endarteritis. So auscultation detect murmur over the left subclavian artery. So sir, you know that left subclavian artery is also a large vessel disease, a large vessel here. So murmur over the left subclavian artery, and ESR is elevated. Angiography shows occlusion of the left common carotid artery and partial stenosis up to some 47% of the left subclavian artery. So sir, you know very well now that our hand artery or hand vessels are large vessels in size. So we got it from the question. The hallmark finding for Takayasu arteries here are the large vessel is included here with the no pulse. So I hope you will make it clear now. Next is sarcoidosis. Sarcoidosis is a systemic inflammatory disease which primarily affects the lungs and lymph nodes. So sarcoidosis, what we are going to see in the patient, lymphadenopathy because this is affecting the lymph nodes, respiratory issues because it is affecting the lungs, some fever, fatigue, weight loss, erythema nodosum, which is painful red nodes on the skins. How you are here something written, character formation of non-caseous granuloma. Sir, you have heard about the caseous necromas in another pathologies like tuberculosis. So a non-caseous granuloma is seen in which cases? Now you know that in sarcoidosis we can see that. Also in some cases of, or in cases of Hodgkin lymphoma, you will see the non-caseous necrosis or non-caseous granuloma like that. So organs involved will be lungs, lymph nodes, eyes, liver, heart, nervous system, spleen. But remember that it will primarily affect the lung and lymph nodes. So let's hear it from our patient. So our patient is 37-year-old, enlarged lymph nodes, cervical and mediastinal. ESR is elevated. Biopsy, this is some error here. Biopsy says granuloma that consists of epithelial giant cell without caseous necrosis. So sir, non-caseous necrosis, they say granuloma they have found, which is the sarcoidosis is characterized by the formation of non-caseous granulomas. And so the case is related to sarcoidosis. I hope you understand the profile of sarcoidosis now. How you will diagnose it, sir? Sir, the main good finding is take the biopsy and check if it is caseous or non-caseous. So if it is non-caseous, suspect differently than tuberculosis. So X-ray can show some finding. X-ray and CT will show the enlarged lymph nodes. Sir, how to correct the patient? Sir, this is systemic inflammatory disease, or let's say autoimmune disease. So prescribe corticosteroids. One of the best is prednisolone. Let's go next. Next is furuncle. So what is furuncle? Also known as boil, deep skin infection that begin in a hair follicle caused or sebaceous glands. Probably the cause is streptococcus most of the time. So a red swollen painful lymph node or bump, the abscess formation we can see in the patient, or pus filled, we can see the furuncle is pus filled. The central necrosis, this is something hallmark finding which you can remember, that central necrosis there will be a black dot over the inflammation. So localized to a single area like neck. If it is in neck, so it will be localized to the neck itself. So neck, armpit, face, back, buttocks, these are the common sites to highlight for a furuncle. Painful, it will be painful because the pus is there causing congestion. So pus is always painful or abscess. So the patient complains of inflammatory filtration in middle third of the left forearm, a 3 centimeter cone-like shape over the skin. The skin is hyperemic, edematous, sharply painful. On the apex, there is a small accumulation of pus with the black dot in the center. Sir, what is this black dot? Sir, this black dot is central necrosis of the hyperemic or edematous area, which is sharply painful over there. So you can see the hallmark finding you have found in the question. So I hope you will mark the furuncle correct now. Sir, how to treat this condition? Sir, first we will try with the antibiotics. We can prescribe antibiotics to the patient. If the condition is severe for the patient, then we have to go for the surgical removal as well. So this is about furuncle. Next is carbuncle. Carbuncle is the deep skin infection caused by Streptococcus A, consisting the multiple interconnected furuncles. So sir, furuncle was the single hair follicle inflammation, but carbuncle is the group of inflammations, or let's say interconnected furuncles or boils. So furuncle will be single and carbuncle will be multiple. I highlighted it very well so that you remember that when you see multiple will be what? Carbuncle. So what are the symptoms we are going to see in the patient? Multiple pustules. So a lot of pustules will be there resembling a single furuncle. So a lot of furuncles will be there, which is carbuncle. Multiple pustules, purulent discharge, deep red painful swelling in the neck, central necrosis, surrounding induration, edemata, fever, malaise, all those conditions. Let's hear it from the patient, what our patient is complaining exactly. Patient have fever, chills, headache, difficult in sleeping because it's painful, poor appetite. On the back of the neck, there is a large purple, cyanotic, sharply painful, dense infiltrate. In the center of the infiltrate, there is a opening that discharges pus, which is yellow and green. So sir, remember that this is the case of carbuncle, although nothing like multiple thing is said in the question. I know you were looking for that multiple pustules in the patient. Sir, how we will differentiate between furuncle and carbuncle? Sir, furuncle is single with the single black dot necrosis in the center, and in the carbuncle, see that there will be a lot of multiple pustules are there. The question will not say this to you, but we have to understand that the sharply painful dense infiltrate is what. So the infiltrate is consist of a lot of necrotic debris, a lot of white blood cells, abscess is there. So this is a big problem. So one finding here is that this is dense infiltrate, sir. A lot of inflammations will be there. And next is the abscess or the pus is this severe that in the center of the infiltrate openings discharges, that from the center the pus is this much in the cases of carbuncle, that it discharge pus by itself, which is yellow and green in nature. So these were the questions which I found in related to the carbuncle. If you see more questions related to the furuncle and carbuncle, you can let me know in the comments in order to help other students as well. So let's go next. Next is sir Alzheimer's disease. So this is the progressive neurodegenerative disorder that affects the memory, thinking and behavior of the patient. So the patient, I have made a mnemonic for you that there will be amnesia, anomia, all of these things you can remember through the mnemonic. However, it will be easy to diagnose in the patient that there will be memory loss, short term memory loss, the inability to recall the name of the objects. If you tell to the patient what is this, so patient cannot recognize this is a pen. So difficulty performing familiar tasks. So in our croc question they say that the patient, how can the patient forget to get back home or forget the way back to the home? So this is something familiar task, so the patient cannot recall such tasks. So inability to recognize object, faces, sounds, that the patient may forget his friend face, how they look like, what is if this is dog barking or cat barking, so cat meowing, so it will be the patient will forget about it. So difficulty with speech and language, let's hear it from our patient. Our patient is 70-year-old. So history of 6 months ago, the condition of the patient is deteriorating. The patient is forgetting the way back to home. So we got our hallmark finding, guys. And difficulty in performing usual daily activities, signs of emetic aphasis observed. So sir, what are they? So amnesia is memory loss, and aphasis is difficulty in performing the familiar task. So periodically noticed low mood and slight anxiety. History, cerebrocranial trauma, diabetes mellitus for 15 years. So the patient had some cerebrocranial trauma as well, due to which all of these memory losses and the 5A are appearing of the Alzheimer's disease. So I hope you understand the Alzheimer's disease. Next is hidradenitis. So hidradenitis is chronic inflammatory skin disease that affects the sweat glands, lead to the painful nodules and abscesses. So sir, the main thing you can remember about hidradenitis is it will be more common in the axillary area, in the armpits, or let's say in the underarm area or region. So by this itself you can solve the croc question easily. The question says about axillary for sure. So let's hear it from our beautiful woman. Pain in the right axillary region, temperature is there, right axillary region has two formation, 2 centimeter each. Skin over formation is dark red and thin. Palpation detect yellow-white discharges from the fistular opening. There is a fistula which is discharging pus, which we have seen in the cases of carbuncle as well. So remember that carbuncle was a different profile, but let's say fever and all those symptoms will be there, like in the same as abscess, the rubor, dolor, calor. So but remember that in the axillary region, when they are asking the fistula discharging pus, painful and all of these things, so this is hydradenitis. All right. Next is coarctation of aorta. Coarctation of aorta is usually the narrowing of the aorta, usually near the patent ductus arteriosus. So what are the symptoms which we are going to see in the patient? Symptoms are mentioned below the question in the last lane. So clinical features will be hypertension in upper limbs, hypotension in lower limbs, and systolic murmur. These are something hallmark findings for the coarctation of aorta, which is the difference between the BP of upper limb and lower limb. This is the hallmark finding here. Let's hear it from our pediatric patient. 11-year-old boy having nosebleeds, fatigue during walking, lag in the physical development of lower half of the body. BP is increased in the arms and decreased in the legs. So you got your hallmark finding for the question, right? So borders of the heart extended left, systolic noise, and EC shows axis of the heart is horizontal. Chest X-ray shows left-sided cardiomegaly, erosions, ulcerations. Please don't mark rheumatoid arthritis for this question. Ulcerations you can see in the cases of RA as well, but this is the different profile. You can watch the video over rheumatoid arthritis. I have explained in a very shorter way. So sir, here you have got your hallmark findings. Then about the BP in arms is increased and BP in legs is decreased. So it can be vice versa as well. All right, so I hope you will mark this question correctly. Coarctation of aorta. Next is brucellosis. So sir, only one thing to remember about brucellosis, that this is caused by the goat, sheep and cattle, dogs, so domestic animals. In the symptoms which you are going to see is the same infection profile. So you might have heard the infection profile a lot of time from me in the previous videos. So hepatosplenomegaly, high fever, recurrent chills, excessive sweating. Polyadenitis is something hallmark finding for brucellosis, like swollen lymph nodes. So the main thing to remember for the croc question in the cases of brucellosis, sir, so the question will say to you, a milker is there. So milker is who is living with the domestic animals and taking their milk for selling purposes and a lot of purposes, whatever. So just to remember that in the croc question will give you there is a woman who is a milker, and these symptoms are developed in her. So what you are going to mark, remember about brucellosis. This is it with this video. I hope you are getting my points. If there is something, let me know in the comments. See you in the next video.